Question 1. A pharmacy technician receives a prescription for amoxicillin 250 mg per 5 ml. Take 5 ml by mouth 3 times daily for 10 days. How much total amoxicillin suspension should be dispensed? A. 75 ml. B. 100 ml. C. 150 ml. D. 250 ml. Answer: C. 150 ml. This question tests basic dosage calculation, specifically determining the total volume needed for a prescription. The key information is the dose per administration, 5 ml, the frequency, 3 times daily, and the duration, 10 days. To find the total volume, first calculate the daily volume, 5 ml per dose x 3 doses/day equals 15 ml per day, then multiply by the number of days, 15 ml per day x 10 days equals 150 ml. Pharmacy technicians must accurately calculate the total quantity to dispense, ensuring the patient has enough medication for the entire course of treatment. Remember, always break down complex calculations into smaller, manageable steps. Question 2. Which of the following is a Schedule II controlled substance? A. Alprazolam. B. Codeine. C. Oxycodone. D. Tramadol. Answer: C. Oxycodone. This question focuses on the classification of controlled substances, a crucial area for pharmacy technicians due to strict handling and dispensing regulations. Schedule II drugs have a high potential for abuse and dependence, but also accepted medical uses. Examples include opioids like oxycodone, found in OxyContin or Percocet, and stimulants like Adderall. Alprazolam is Schedule IV, codeine, alone, is Schedule II but in combination products can be Schedule III or V, and tramadol is Schedule IV. Accurately identifying controlled substances is vital for proper inventory management, security, and legal compliance. Always double-check a drug schedule, as regulations are very strict for these medications. Question 3. What is the primary purpose of a look-alike, sound-alike, LASA medication list? A. To identify medications with similar side effects. B. To prevent medication errors due to name confusion. C. To categorize medications by their therapeutic class. D. To track medications requiring refrigeration. Answer: B. To prevent medication errors due to name confusion. This question addresses patient safety, specifically concerning LASA medications. The core concept is medication error prevention, and the keywords look-alike, sound-alike directly point to drugs that can be confused due to similar spellings or pronunciations, such as prednisone and prednisolone. The primary purpose of such a list is to highlight these high-risk medications, prompting pharmacy staff to implement additional safety checks, like confirming the indication or dosage strength. This helps minimize dispensing errors that could harm patients. Always pay extra attention when handling medications on the LASA list, as a simple mix-up can have serious consequences. Question 4. A patient drops off a prescription for lisinopril 10 mg number 30, take 1 tablet daily. What is the day's supply for this prescription? A. 10 days. B. 15 days. C. 30 days. D. 60 days. Answer: C. 30 days. This question tests the calculation of days' supply, which is essential for billing, inventory, and patient adherence. The concept involves determining how long a dispensed quantity of medication will last. The key information is the total quantity dispensed, number 30 tablets, and the dosing instructions, take 1 tablet daily. Dividing the total quantity by the daily dose, 30 tablets/1 tablet/day, gives a day's supply of 30 days. Accurately calculating days' supply ensures proper billing to insurance and helps prevent patients from running out of medication too soon or receiving too much. Always confirm the dosing frequency to calculate days' supply correctly. Question 5. Which organization accredits pharmacy technician training programs? A. National Association of Boards of Pharmacy, NABP. B. American Society of Health System Pharmacists, ASHP. C. Accreditation Council for Pharmacy Education, ACPE. D. Pharmacy Technician Certification Board, PTCB. Answer: B. American Society of Health System Pharmacists, ASHP. This question tests knowledge of important organizations in pharmacy, specifically focusing on program accreditation. The American Society of Health System Pharmacists, ASHP, is the primary organization that accredits pharmacy technician training programs in the United States, ensuring they meet specific educational standards. While PTCB is involved in certification, and NABP deals with state boards of pharmacy, ASHP's role is program accreditation. Understanding the roles of these organizations helps technicians recognize the standards that guide their education and practice. Knowing which bodies regulate different aspects of pharmacy helps you understand the profession's structure. Question 6. What does the abbreviation NPO mean on a patient's medication order? A. As needed. B. Nothing by mouth. C. Nightly, at bedtime. D. Normal saline only. Answer: B. Nothing by mouth. This question tests knowledge of common medical abbreviations, which are critical for accurately interpreting prescription orders and patient instructions. NPO is a widely used Latin abbreviation standing for nil per os, meaning nothing by mouth. This instruction indicates that a patient should not ingest any food, drink, or oral medications, often before surgery or certain medical procedures. Correctly interpreting abbreviations prevents medication errors and ensures patient safety. Always clarify any ambiguous or unfamiliar abbreviations to avoid misunderstandings in patient care. Question 7. A technician is restocking the pharmacy's refrigerator. Which temperature range should be maintained for refrigerated medications? A. 0 to 2 degrees Celsius, 32 to 35 degrees Fahrenheit. B. 2 to 8 degrees Celsius, 36 to 46 degrees Fahrenheit. C. 8 to 15 degrees Celsius, 46 to 59 degrees Fahrenheit. D. 15 to 25 degrees Celsius, 59 to 77 degrees Fahrenheit. Answer: B. 2 to 8 degrees Celsius, 36 to 46 degrees Fahrenheit. This question assesses understanding of proper drug storage conditions, which is crucial for maintaining medication efficacy and safety. The standard temperature range for refrigerated medications, including many vaccines, insulins, and antibiotic suspensions, is 2 to 8 degrees Celsius, equivalent to 36 to 46 degrees Fahrenheit. Temperatures outside this range can degrade the medication, making it less effective or even harmful. Proper storage ensures that medications retain their potency until their expiration date. Always monitor and document refrigerator temperatures daily to ensure compliance with storage guidelines. Question 8. Which of the following is a common side effect of opioid analgesics? A. Diarrhea. B. Constipation. C. Hypertension. D. Insomnia. Answer: B. Constipation. This question evaluates knowledge of common drug side effects, which is important for patient counseling and recognizing potential issues. Opioid analgesics, like morphine or hydrocodone, are effective pain relievers, but they commonly cause gastrointestinal slowing, leading to constipation. Other frequent side effects can include nausea, vomiting, and drowsiness. Understanding common side effects allows pharmacy technicians to anticipate patient needs and offer non-pharmacological advice or suggest over-the-counter remedies, such as stool softeners, under pharmacist supervision. Knowing typical side effects helps you prepare patients for what to expect from their medication. Question 9. What does the term PRN mean on a prescription? A. By mouth. B. Before meals. C. As needed. D. At bedtime. Answer: C. As needed. This question tests knowledge of common Latin abbreviations used in prescriptions, which is fundamental for accurate dispensing. The abbreviation PRN stands for pro re nata, which translates to as needed. This indicates that the medication should be taken only when the patient experiences specific symptoms or conditions, rather than on a fixed schedule. For example, a pain medication might be prescribed PRN pain. Correctly interpreting PRN ensures patients use their medication appropriately and avoid unnecessary doses. Always ensure patients understand how and when to take as needed medications. Question 10. Which piece of personal protective equipment, PPE, is essential when compounding sterile preparations in a laminar flow hood? A. Safety glasses. B. Face mask. C. Sterilized gloves. D. Hearing protection. Answer: C. Sterilized gloves. This question focuses on sterile compounding procedures and the necessary personal protective equipment, PPE, to maintain aseptic conditions. When preparing sterile products, such as intravenous, admixtures, preventing contamination is paramount. While a face mask and safety glasses are also often used, sterilized gloves are absolutely essential and directly contact the sterile environment to protect the product from contamination from the technician's hands. Proper gloving technique is crucial for minimizing the introduction of microorganisms into sterile preparations. Always remember that strict adherence to PPE protocols directly impacts patient safety in sterile compounding. Question 11. What is the generic name for the brand name drug Zithromax? A. Amoxicillin. B. Azithromycin. C. Ciprofloxacin. D. Clarithromycin. Answer: B. Azithromycin. This question assesses knowledge of common brand name and generic drug equivalents, which is a core competency for pharmacy technicians. Zithromax is a widely recognized brand name for the antibiotic azithromycin. Knowing both brand and generic names is crucial for accurate dispensing, patient counseling, and managing inventory. Patients often refer to medications by their brand names, so technicians must be able to identify the corresponding generic. Familiarity with common brand/generic pairs improves efficiency and reduces the risk of dispensing errors. Always try to link brand names with their generic counterparts when learning new medications. Question 12. According to federal law, how long must a pharmacy maintain records of Schedule II controlled substance prescriptions? A. 1 year. B. 2 years. C. 5 years. D. 7 years. Answer: B. 2 years. This question tests knowledge of federal regulations concerning controlled substances, a critical area for legal compliance in pharmacy practice. Federal law, specifically the Controlled Substances Act, mandates that pharmacies maintain records for Schedule II controlled substance prescriptions for a minimum of 2 years. However, individual state laws may require a longer retention period, and pharmacies must always comply with the stricter of the two. Proper record keeping is essential for accountability, audits, and preventing drug diversion. Always verify state-specific requirements, as they might be more stringent than federal guidelines. Question 13. Which of the following drugs is classified as a proton pump inhibitor, PPI? A. Famotidine. B. Metformin. C. Omeprazole. D. Prednisone. Answer C. Omeprazole. This question tests knowledge of drug classifications, which helps pharmacy technicians understand medication uses and potential interactions. Proton pump inhibitors, PPIs, are a class of drugs that work by significantly reducing stomach acid production and are commonly prescribed for conditions like GERD, gastroesophageal reflux disease, and ulcers. Omeprazole, Prilosec, is a classic example of a PPI. Famotidine is an H2 blocker, metformin treats diabetes, and prednisone is a corticosteroid. Understanding drug classes helps technicians anticipate common uses and side effects, making it easier to identify potential errors or counsel patients. Learn common drug endings like prazole for PPIs to help remember classifications. Question 14. What information is always required on a prescription label by law? A. Patient's phone number. B. Drug's expiration date. C. Pharmacy's fax number. D. Prescriber's DEA number. Answer B. Drug's expiration date. This question covers essential elements of a prescription label, which are mandated by law to ensure patient safety and proper medication use. A prescription label must include the drug's name, both generic and brand, if applicable, strength, quantity, dosage form, expiration date, lot number, pharmacy name and address, prescription number, patient's name, prescriber's name, dispensing date, and clear directions for use. The expiration date is crucial as it indicates when the medication may no longer be fully potent or safe. Always ensure all legally required information is present and accurate on every dispense label. Question 15. A pharmacy technician receives a prescription for eye drops. What auxiliary label should always be placed on the container? A. For external use only. B. Shake well before use. C. For the eye. D. Take with food. Answer C. For the eye. This question focuses on the importance of auxiliary labels for clear patient instructions and safety. When dispensing eye drops, it is crucial to clearly label them for the eye or ophthalmic use only to prevent accidental ingestion or use in other body orifices. While shake well might apply to some suspensions and external use only to other topical products, the specific for the eye label prevents dangerous confusion. Auxiliary labels provide critical information that supplements the main directions, helping patients use their medications correctly and safely. Always apply specific auxiliary labels to ensure clarity for patients. Question 16. What is the appropriate needle gauge for preparing an intramuscular, IM, injection for an adult? A. 18 gauge. B. 20 gauge. C. 25 gauge. D. 27 gauge. Answer B. 20 gauge. This question pertains to the practical aspects of medication administration, specifically needle selection for injections, which is relevant for technicians involved in sterile compounding or medication preparation. Needle gauge refers to the diameter of the needle, with a smaller gauge number indicating a larger diameter. For most adult intramuscular, IM, injections, a 20 to 22 gauge needle is typically appropriate to ensure proper medication delivery into the muscle tissue. An 18 gauge is generally too large for IM injections and often used for drawing up viscous medications, while 25 to 27 gauge needles are typically used for subcutaneous or intradermal injections. Selecting the correct needle gauge is vital for patient comfort and effective medication delivery. Question 17. Which dosage form is designed to release medication slowly over an extended period? A. Immediate release tablet. B. Chewable tablet. C. Sublingual tablet. D. Extended release capsule. Answer D. extended-release capsule. This question tests knowledge of different dosage forms and their release mechanisms, which impacts how a patient takes medication and its effect. An extended-release, ER or XL, dosage form, like an ER capsule, is specifically engineered to release the active drug gradually over many hours, reducing the frequency of dosing and maintaining more consistent drug levels. Immediate-release tablets dissolve quickly, chewable tablets are broken down by chewing, and sublingual tablets dissolve under the tongue for rapid absorption. Understanding dosage forms helps technicians explain administration instructions to patients and ensures proper drug efficacy. Always advise patients not to crush or chew extended-release medications unless specifically instructed. Question 18. A patient is allergic to penicillin. Which antibiotic class should generally be avoided due to potential cross-reactivity? A. Macrolides. B. Tetracyclines. C. Cephalosporins. D. Fluoroquinolones. Answer: C. Cephalosporins. This question addresses drug allergies and cross-reactivity, a crucial aspect of patient safety in pharmacy. Patients with a penicillin allergy have a risk of experiencing an allergic reaction to cephalosporins, another class of beta-lactam antibiotics, due to structural similarities. While the cross-reactivity rate is relatively low, it is a significant consideration, especially for patients with severe penicillin allergies. Macrolides, tetracyclines, and fluoroquinolones are generally considered safe alternatives. Always flag penicillin allergies in patient profiles and double-check orders for potential cross-reactive drugs to ensure patient safety. Question 19. What does the term dispense as written, DA, code 0 mean? A. Substitution permitted by prescriber. B. Substitution not permitted by prescriber. C. Substitution not permitted by patient. D. Substitution not permitted by pharmacy. Answer: A. Substitution permitted by prescriber. This question tests understanding of DA, dispense as written, codes, which are used in pharmacy to indicate prescriber preferences regarding generic substitution. DA code 0 specifically means substitution permitted by prescriber, implying that the pharmacist can dispense a generic equivalent if available and appropriate. Other DA codes specify reasons why generic substitution is not allowed, such as DA 14 prescriber requires brand. Correctly interpreting DA codes is essential for accurate dispensing, proper billing, and adherence to prescriber instructions. Familiarize yourself with common DA codes, as they directly impact which medication is dispensed. Question 20. Which government agency is responsible for enforcing the Controlled Substances Act? A. Food and Drug Administration, FDA. B. Centers for Disease Control and Prevention, CDC. C. Drug Enforcement Administration, DEA. D. Occupational Safety and Health Administration, OSHA. Answer: C. Drug Enforcement Administration, DEA. This question assesses knowledge of key government agencies regulating pharmacy practice, specifically those involved with controlled substances. The Drug Enforcement Administration, DEA, is the federal agency primarily responsible for enforcing the Controlled Substances Act, which regulates the manufacture, distribution, and dispensing of narcotics and other controlled substances. The FDA regulates drug approval, the CDC focuses on public health, and OSHA addresses workplace safety. Understanding the DEA's role is critical for pharmacy technicians to ensure compliance with strict controlled substance regulations, preventing diversion and ensuring accountability. The DEA is your go-to agency for anything related to controlled substance regulations. Question 21. What is the proper procedure for handling a medication recall? A. Immediately return all affected stock to the wholesaler. B. Separate and quarantine the recalled medication from active stock. C. Continue dispensing the medication until a replacement arrives. D. Notify the patient only if they experience an adverse effect. Answer B. Separate and quarantine the recalled medication from active stock. This question covers medication recall procedures, a vital aspect of patient safety and inventory management. Upon notification of a medication recall, the immediate and most critical step is to physically separate and quarantine the affected product from the rest of the pharmacy's active inventory. This prevents accidental dispensing of the recalled item. Further steps involve determining the recall class 1, 2, or 3, notifying affected patients, especially for Class 1, and following the manufacturer's or distributor's instructions for return or destruction. Proper handling of recalls protects patients from potentially harmful or ineffective medications. Always act quickly to isolate recalled products to safeguard patients. Question 22. When preparing an 4 admixture, what is the purpose of swabbing the vial stopper with an alcohol pad? A. To prevent air bubbles. B. To sterilize the surface. C. To cool the medication. D. To dissolve the powder. Answer B. To sterilize the surface. This question relates to sterile compounding techniques and the principles of asepsis. When preparing an intravenous 4 admixture, maintaining sterility is paramount to prevent contamination and patient harm. Swabbing the rubber stopper of a medication vial with an alcohol pad, usually 70% isopropyl alcohol, is done to disinfect or sterilize the surface, killing any microorganisms present before a needle is inserted. This reduces the risk of introducing bacteria into the sterile medication and, subsequently, into the patient's bloodstream. Aseptic technique, including proper swabbing, is fundamental to sterile compounding safety. Always swab thoroughly and allow the alcohol to dry completely before puncturing. Question 23. A patient presents a prescription for a non-controlled medication, but it is missing the prescriber's signature. What should the technician do? A. Fill the prescription and flag it for the pharmacist. B. Return the prescription to the patient to get a signature. C. Contact the prescriber's office to obtain the signature. D. Dispense the medication as written without a signature. Answer C. Contact the prescriber's office to obtain the signature. This question addresses prescription validity and the technician's role in addressing incomplete prescriptions. A valid prescription legally requires a prescriber's signature, even for non-controlled medications. If the signature is missing, the technician must not dispense the medication. The correct procedure is to contact the prescriber's office to obtain the necessary information, such as a verbal confirmation followed by a faxed or e-signed prescription, or an actual signature on the hard copy. This ensures the prescription is legal and reduces the risk of errors or fraud. Never dispense a prescription with missing essential information. Always clarify with the prescriber. Question 24. Which type of insurance plan typically requires a patient to select a primary care physician, PCP, within their network? A. Preferred Provider Organization, PPO. B. Health Maintenance Organization, HMO. C. Point of Service, POS. D. Indemnity Plan. Answer B. Health Maintenance Organization, HMO. This question tests knowledge of different types of health insurance plans, which is crucial for pharmacy billing and understanding patient benefits. A health maintenance organization, HMO, plan typically requires members to choose a primary care physician, PCP, within the plan's network and obtain referrals from their PCP to see specialists. This structure aims to manage healthcare costs and coordinate care. PPOs offer more flexibility without requiring a PCP or referrals, though out-of-network care costs more. Understanding these differences helps technicians process claims correctly and answer basic patient questions about their coverage. Familiarize yourself with how different insurance plans affect patient choices and costs. Question 25. What is the meaning of the abbreviation QID on a prescription? A. Once a day. B. Twice a day. C. 3 times a day. D. 4 times a day. Answer: D. 4 times a day. This question assesses knowledge of common Latin abbreviations for dosing frequency, which are essential for accurately interpreting prescription instructions. The abbreviation QID stands for quater in die, meaning 4 times a day. Understanding these abbreviations ensures that patients receive the correct dose at the correct intervals, which directly impacts medication effectiveness and patient safety. For example, BID is twice a day, and TID is 3 times a day. Always be precise when interpreting frequency abbreviations to prevent medication errors.